Hi, this is Dr. Sagar, and this is a video about why I don't believe in doing 5,000 or 6,000 grafts in a single day's time. Now, for most people it will sound very attractive. Doing such large sessions in one day, isn't that beneficial for the patients? No, here is the reason why. The duration of the surgery really matters, and for 4,000 and 5,000 grafts, the surgery can extend beyond 11 hours. And this is the reason why patients often find it extremely discomforting. Also, the amount of anesthesia you can use in single day is limited. You can't just simply keep on adding anesthesia just because the patient requires it. There is a top limit, and if you cross the top limit, you're going to end up in a toxic dose. Long procedures means grafts are going to be staying out of the body for quite a long time, and it's not safe for them to be out of the body for more than 6 or 7 hours. And no matter what solution you keep in, beyond 6 or 7 hours, graft quality is going to decline. And when you implant them, they are not going to grow properly. The bigger team which is required to conduct such a large procedure, anything beyond 4,000 grafts in a day or even 3,000 grafts in a day, is going to require a large team of technicians and assistant staffs and all that. The number of people inside OT matters, because the higher the number of people, higher the risk of contamination, higher the risk of infection. And the graft handling is supposed to be monitored. If there are too many people assisting and doing these large procedures, it becomes hard to monitor who is doing it properly and who is not doing it properly. I generally spread out my procedures for 2 days or at times even on 3 days. I don't like to push the surgery beyond 4 to 5 hours, and my patients can go back home and come back the next day for the surgery. Of course, it takes more number of hours to do the procedure in total, but since it is spread out over 2 or 3 days, there is always a very good comfort which is given to the patient. And the risk of anesthesia is pretty slim because we don't have to give so much anesthesia. And even if the patient needs midway that he's feeling some pain, we can always stop off the anesthesia because we have so much limit for a day remaining. Another thing is, I work with a small team, 2 or 3 people who are highly specialized. So I don't need a bunch of people in the OP room, increasing the chances of manhandling of the grafts and causing contamination or infection or breaking the sterility of the operating room. It does take more time, and it is of course going to be slightly on the higher side of the cost. But for those people who are looking at quality over quantity, my clinic is for you. If you look at 9 months down the line, what matters to majority of the patients is not how many grafts you planted, these are just theoretical, but what you got on the skull, how good the results look, how natural they look, and how dense and voluminous your hair transplant looks. And for that, you have to give time for the procedure. And it's just like any other thing, like even the doctor's consultation. You don't want the doctor's consultation to be rushed. You want the doctor to give you time to explain all the things. So then when it comes to hair transplant, why are people rushing so much? And the answer is very similar. People want to rush so much because they want to compact as many surgeries as possible in a month's time. And this is good from a business standpoint, but for patients, it does no good. So I can do lesser number of the cases in a month's time, but every single one of those cases are going to be 5-star cases. So if you want quality or quantity, come to me.